first met Mr. Wilson when his clinical team consulted me. Mr. Wilson was a patient that needed a medical procedure done, but he was adamantly refusing, and we didn't understand why. To the clinical team, it was a simple decision. It was a minimally invasive treatment that had high benefits and high outcomes for this patient. I remember how difficult it was for the staff to witness Mr. Wilson refusing this procedure that seemed like such a simple decision. What do we do for patients who don't allow us to provide the care that we think that they need to receive?
So the ethics advisor's story. Karen and I have worked in clinical ethics for a number of years, and we've always been blessed to work for big healthcare systems that really have support for clinical ethics. We've seen firsthand what a difference it can make in patient cases when there's access to ethics services. We found that systems that really embrace clinical ethics tend to have better outcomes for their patients and tend to build a culture of ethics that really impacts the care they provide for patients, but also the workplace for those healthcare providers. Often we were getting calls from colleagues in other cities and other healthcare systems that did not have access to ethics, and they would call and ask what to do. We were kind of struck by how clinical ethics can really be out of reach, especially for small rural healthcare systems. At the onset of the COVID-19 pandemic, we were starting to see a lot of cases that healthcare systems really were wrestling with that they hadn't encountered before. Questions about how to ration scarce ICU or critical care resources, questions about the best decisions to make for patients when they weren't allowed to have surrogates or visitors in the hospital, questions even about things that seem as easy to solve as how do you sign an advance directive or a living will when the patient's COVID positive and the nurse can't go in the room to hand them a pen. I'm Alexandra Perry, and I'm the Chief Executive Officer for Ethics Advisors.
And I'm Karen Tangway, and I'm the Chief Ethics Officer for Ethics Advisors.
In our medical training, we're taught to know the answer, to assess a patient and make a clinical judgment about the best path forward. This doesn't mean that we make a unilateral decision, but there are instances where there just seems to be no good path forward, or in which different family members disagree, or the family insists on a treatment that I really don't feel comfortable with. These situations feel uncomfortable because there doesn't seem to be a right answer. It is such a huge benefit to have access to ethics consultation for these patients. There might still be no right answer, but having a clinical ethicist work through the ethical considerations can make the best path forward much more clear.
But COVID-19 is what really prompted us to start working with these healthcare systems. Once we realized that virtual ethics consultation was going to be a viable option, what we started to think about was then how to tailor it to the different healthcare systems we'd be working with. So we were excited to be able to offer a variety of services and really to reach out to those hospitals that haven't had a culture of ethics before and that really would like to start offering those services to their patients.
Our mission at Ethics Advisors is to provide our clients with the best ethical advice in the most difficult patient care scenarios. To me, what that means is we're providing an extra layer of support for providers, being that listening ear if they need one. It's those cases in which the distinction between what's right and what's wrong is not so obvious, and the path forward towards a solution is not so clear. That is when we're here as Ethics Advisors to provide that support to our clients.
The coronavirus pandemic has changed so much about the world around us. The practice of medicine and the process of accessing medical care are definitely no exceptions to this. Hospitals have needed to find ways to minimize the numbers of staff present within their buildings and to minimize the numbers of staff members who interact with any given patient. Those are in order to keep the patients and the staff safe and also to reduce the amount of PPE that the hospitals require to keep running. The result of this has been that hospitals and physicians are increasingly turning towards virtual methods of consultations with specialists. Telemedicine is being used more now than it ever has been in the past, and physicians are more comfortable with telemedicine now than they ever have been in the past. So we feel very confident that the virtual consultations Ethics Advisors can provide are an ideal solution to meet the increasing need for access to clinical ethics services.
A lot has changed over the last year. Can you tell me about how COVID has changed clinical ethics?
I actually think it's kind of amazing to see the difference from, last March, just a year ago. I think the field is changing so that virtual consultation is becoming a standard of care. It's actually been a great opportunity to be able to show them what we can do through telehealth, because I think some of the systems who didn't have ethics consultation services before now realize how easy it would be for them to integrate ethics service into their daily practices.
So COVID-19 is just one of many examples in which we're dealing with things we never thought we would be dealing with in healthcare. And so whether it's new technological innovations that medicine now has, or navigating through nuances and preferences of patients. Clinical ethics is so important to be a stakeholder in the patient's care when the issues that are arising are not strictly about medical interventions, but nonetheless impact the care that patients are receiving. That's what I'm most proud about, right? Is being able to tap into those resources that a hospital has, the various departments, the care teams, the specialties, and really bringing together, rallying around a patient to make sure that we have the best resources available to us to lead to the best patient outcomes. And that's why I think clinical ethics is so important. So I know one of the things we're most excited about is ethics advisors' ability to be more accessible to healthcare systems. Tell me a little bit more about how you think we'll be able to do that.
I'm really excited, especially about the need that we can fill for these rural facilities that can't necessarily afford to have a full-time clinical ethics service. For them to have access to us via telehealth 24 hours a day, 7 days a week, I think that's the thing I'm most excited about. Developing quality ethics education that's accessible to all of their staff and not having to schedule and have everybody in the same conference room, right? Being able to do that as they need to for their licensure is really exciting.
For physicians, some of the most important tenets are to do no harm and to act in the best interest of the patient. While those seem like they should be straightforward tasks, sometimes they really aren't. Sometimes a patient is unable to communicate his or her wishes. Sometimes it isn't obvious which family member should be making decisions on the patient's behalf. Sometimes families need to process their feelings and even guilt about deciding to end life-sustaining treatments. Sometimes clinicians need guidance or support while making decisions in difficult cases. These are all situations in which I would call ethics advisors. Their professional ethicists can help clinicians and families make sure that the medical care provided is truly in the best interest of the patient.
So after days of refusing this procedure and having ongoing conversations with family, with Mr. Wilson, he finally was willing to open up to us and shared with us that his wife a few years ago had been admitted to the hospital for what was supposed to be a very simple procedure. She'd been healthy prior to this admission and just needed this one thing done. Unfortunately, there were complications that resulted in that procedure, and she ended up passing away a few weeks later. So here we are trying to get Mr. Wilson to make this decision that we think is very simple, should be done very easily, but Mr. Wilson has these very real memories and experiences that he is actively reliving as we're talking to him about these medical interventions. So being able to talk through that with Mr. Wilson and with the staff and acknowledge that this was something he was having to go through. It wasn't just the decision of medical intervention that he needed done. It was also the decision of thinking that maybe what happened to his wife would happen to him and whether he would be okay with that. At the end of the day, I think it's so important that we remember patients have stories, they have memories, and they have things that they bring with them into the hospital that impact the decisions that are made every day in clinical care.